If a patient is having symptoms such as rectal bleeding or a change in bowel habits, they usually will get referred for a colonoscopy. A colonoscopy is a scope that's inserted into the rectum to look at the tissue inside the rectum to see if there's any abnormalities. All rectal cancers start in polyps. Therefore, it's very important to get a colonoscopy to see if someone has a polyp. If a polyp is removed, it may not be cancerous, but cancers do start in polyps. So it's very important to have regular routine colonoscopies to remove the lesions that can lead to cancer. Usually, a rectal cancer is diagnosed after a colonoscopy is done. A polyp comes back as cancerous. At that point, further tests are done. This may include a test called an endoscopic ultrasound, which helps us identify how deep the tumor is, how much of the muscle of the rectal wall is involved by the tumor. And it's a very important test for staging rectal cancer. Rectal cancer therapy depends on the stage that it is. Therefore, this test of the endoscopic ultrasound is an important test for staging. Stage for stage, when you compare rectal cancer to colon cancer, rectal cancers do have a slightly higher risk of recurrence. We stage rectal cancers by 3 different ways. The T stage is the tumor stage. That means the depth of the tumor through the rectal wall. The N stage is the lymph node stage. That means how many lymph nodes are involved with cancer. The M stage is the metastasis stage. That means spread of the disease outside of the rectum into another organ. If there are metastases, that is stage 4. If there are no metastasis and there are no lymph node involvement, there's no lymph node involvement, then that is stage 1 or 2. Lymph node involvement means stage 3. Stage 1 and 2 rectal cancer is usually treated by surgery alone. Stage 3 rectal cancer usually is treated with a combination of chemotherapy and radiation prior to surgical resection of the cancer. Stage 4 rectal cancer, which means disease that has spread beyond the rectum into other organs and to distant organs, is the 4th stage, and that is treated with chemotherapy and targeted therapies.